Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today, coming to you just outside of Salt Lake City, Utah. This is episode 151 of the Everything Medicare Podcast, where every single week I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Thank you so much for taking some time out of your busy Monday, as I'm sure, we're all busy as we're starting the week. Thank you for joining me today, taking some time to be with me. I can't tell you how much I appreciate it. And I wanted to kind of start today's show off a little bit with some news on kind of some things that are coming up here pretty soon. So first things first, I've been talking about my latest book, The Insurance Funnel, on this podcast and this platform since September. And I was originally planning on having it out by December, or maybe the end of December, I should have you. And I did not get close, okay? Life is oh so busy, and I incredibly underestimated how busy it would be post-enrollment period. It seemed like, at least here for me, we did not slow down very much at all after the enrollment period, after the December 7th deadline for the Medicare enrollment period. And of course, being a new father, I have a 9-month-old daughter, for those of you who followed me for some time in the last couple of years. And my daughter Violet has, taken up a ton of time, which is time that I, of course, am going to make sure I spend with her. And so it's all of these things together has caused the release of the insurance funnel to be postponed. Of course, it is now done. It's in the final works of being ready. I will bring you as much information as I can about when exactly the day it will be released, but it should be in February, so make sure to stay tuned for that. The insurance funnel is basically about 9 tests that any insurance policy should be able to pass in order for it to be worthy of you purchasing it. 9 tests. Every single insurance policy needs to pass it, and if they don't pass all of these 9 tests, it's not worth buying. If it passes 8 of the 9, not worth buying. It's almost designed to be like an actual funnel. You put things into the funnel. As it goes down through the funnel, and the surrounding walls of the funnel narrow, not everything is going to be able to come out. So you put all of the policies you're looking at buying into it, whether it be car insurance, whether it be health insurance, whether it be Medicare, whether it be life insurance, you put them into the funnel, and only the worthy insurance policies are going to come out the other side. I wanted this book to be able to help you in every single type of insurance. I wanted to come up with a formula that translates and crosses barriers over to all different types of insurance, or at least most. And I think that's what we've been able to do with this book. So it's here, it's ready, it's done. It's overseeing some final preparations for it to be released. So please stay tuned for that. I'm going to be doing some press for it. I'm going to be going on a multitude of different podcasts in the next month to talk about the show. As I go on these different shows, I'll make sure we tell you about it so you can go in and listen to my guest appearance on any shows that I might be going on for promo for the book. Last but not least, and then we'll get into this today, to this morning's episode. Last week, I had 2 incredible interviews on the show, back to back, one on Wednesday and one on Saturday. So you don't want to miss those. Go back and listen to those if you didn't hear them already. Now let's talk about propaganda in life and in a multitude of different things. And it's not just here in the United States. It's actually a worldwide thing if you think about it. Propaganda shapes the way we look at things. Propaganda is, in my definition, it's not the Webster's definition, but in my definition of propaganda would be a narrative being painted a certain way to serve the interests of the person putting out the propaganda. Let me say that again. A narrative being painted to serve the purposes of the person putting out the particular propaganda. Okay? What does this mean? Does it mean it's an outright lie? Well, no, not necessarily. It could be. Some types of propaganda are outright lies, and some of you might think one news station politically is propaganda over another. Maybe you think all the news stations are propaganda. Me personally, I'm not very big into politics. I believe that all, or at least a majority of the media, no matter what side of the coin they're on, is propaganda to a certain extent. Both of them can take a news story, report it completely differently, and you could walk out looking at both of them and seeing it and saying, I still don't know exactly what happened because the stories are told so differently. They might as well be different stories. And propaganda is in everything, right? I mean, all over the world. I watched a documentary about a year ago about North Korea. We all know about North Korea. North Korea has all kinds of propaganda. We have propaganda, I'm sure, that we're not even aware of that's kind of pumped into our heads. Propaganda is everywhere, and the Medicare world is no different. The Medicare world has propaganda being pushed at you, shoved down your throat through the internet, through social media, through advertisements you might see, through mailers, and of course on television commercials. The people that are pushing these propagandas and these narratives are, for the most part, in my opinion, from what I've observed, trying to convince you that there is a one-size-fits-all when it comes to your Medicare. And I've spent the last 2 years pushing down your throat that that's utter bullshit, excuse my French. There is no one-size-fits-all for people on Medicare, but that's what they would want you to believe. That is what they want you to believe, for the simple fact that whatever narrative they're pushing on you serves their particular interests specifically, their preferences, their needs, and not yours. The people on Medicare. These people are not hard to spot. These organizations are not hard to spot. And I couldn't tell you how much I have to say about this. But first, I have to take a break. Hear from this week's sponsor. I have a mouthful to let loose on you, because this has been driving me nuts for a long time, and I just figured this has gotten so bad, so toxic, so manipulative, that I had to speak out about it and dedicate an entire episode to it today. You don't want to miss what I have to say. I have some fireworks coming. I'm a little heated about it, and you don't want to miss what my thoughts are going to be. I'm going to take a break, like I said. I will be back. Don't go anywhere. We'll be back in segment 2. Welcome back, everybody. Thanks so much for sticking with me through that break. And I just wanted to kind of start this off by saying, because I can already hear there are my competitors out there, some people that, I would probably consider enemies. And I'm not the type of person that goes out looking for enemies. I want to be friends with everybody. Is there anybody that does something like this, a show where I let people come on that I have absolutely no business interest with, and I am happy to interview them, present them to the audience if I think they can bring value to you? I mean, I, for the most part, have been incredibly gracious with my platform, with everybody that, we've had come on. Now, they've been gracious with me too, because they're big people in the industry. They're very busy people. Of course, they're big names, so they bring eyeballs to the podcast. Of course, it goes both ways. But what I would say is, the last thing that I ever put out for you is propaganda. I tell the truth, nothing but the truth, and I've always said from the very beginning, I don't do any propaganda on this show. Not at all. I am the opposite of propaganda. The show is the opposite of propaganda because ever since the beginning, I've always said that when you get onto Medicare, you need to have something picked out specifically for you based on your specific needs and preferences. What you need specifically. How healthy are you? How many doctors do you see? What do you prefer your plan to look like? Do you have a lot of dental needs? Do you need glasses every year? Do you mind a network? Do you only go to one doctor a year? Are you on kidney dialysis? Do you have cancer? Everybody's different. We're all dealing with different things in our lives. And insurance is meant to do what? Protect us from these things that we deal with in our lives. Protect us from tragedies. Protect us from our body failing us. Protecting us from the unforeseen happening. Not every single insurance policy does that the same way. And not every single insurance policy, especially in the Medicare world, protect the same things. I see so many people that are in the industry. Now, there's a lot of people that do not take this approach. So I'd say it's actually a minority of people that do this, but sometimes the people that do it have the loudest voices. And I'm sure you've seen it, like I said in segment 1. But they push you specifically one direction or the other every single time. And anytime someone tells you that this is the way to go with your Medicare, every single time, all the time, situation be damned, finances be damned, what can you afford be damned, you know that they do not have your best interest in mind. I had Tony on last week. We did an episode with Tony that came out on Saturday. And Tony said specifically, the best agents are the agents that listen. I thought that was so profound. He said the best agents are the agents that listen to what you need. I hope everybody caught that heard that episode. Have you ever gone into a place and they're just basically telling you what you need to do before they listen to what you want? I have. I've gone doctors that do that. I've gone to car dealerships to buy cars that do that. I've had that happen to me in a lot of different aspects of my life. And I know they don't have my best needs in mind. I know they don't care what I want. They care what they want. And these people are no different. If you see a commercial pushing you into a Medicare Advantage plan, let's say, I did an episode a little while ago, a couple weeks back, about how I feel like as a whole, the industry is pushing you towards Medicare Advantage. If you see commercials and advertisements pumping it up without telling you any of the negatives that you need to know, there's an example of propaganda. But it goes the other way too. There's certain people in the industry that I know for a fact have a vested interest in only selling you Medicare supplement policies and not even offering you Medicare Advantage or trying to tell you Medicare Advantage is an awful thing. And you should never pick up a Medicare Advantage plan under any circumstances. And that is complete horse, you know what. But I know for a fact that these people that only want to do Medicare supplement plans for you and want to paint a narrative that if you don't want to get a Medicare supplement plan, you're screwed, and a Medicare Advantage plan is going to send you to hell in a handbasket, they have a vested interest to do it this way because I've said in the past on this platform that for someone like myself that specializes in Medicare plans, that works with people of all different situations, I have a lot more customer service. My office, my organization has a lot more customer service needs to deal with when someone's on a Medicare Advantage plan because there's a lot of working parts. It's a lot more to deal with. There's networks involved. There's a prescription plan included in the plan. There's like I said, there's networks. There's different copays. There's all kinds of things. The plans change every year. Plans pull out of markets. It doesn't mean they're bad for people, but there are a lot of agents and agencies out there that take the approach that this is more work for us. So we're only going to do Medicare supplements and we're going to basically spread the word that Medicare Advantage is evil because it's evil for them, not because it's evil for you. It's less work for the agent to do a Medicare supplement. It just is. It's less work for the agent, and they don't have to spend as much time or resources taking care of you. So they push you in that direction. Simply put, they don't have to take as many certification tests to offer Medicare supplement plans. In fact, they don't have to do any in most cases. There's very few Medicare supplement carriers that make you do anything like that. You just get contracted if you're licensed and you're done. But Medicare Advantage plans, you have to go through all kinds of hoops as a broker. It's a pain in the butt for us. But are there millions of people across the country that are best off with a Medicare Advantage plan? Yes. But these people, anytime you see a YouTube video that tells you Medicare Advantage is evil, I encourage you to run the other way. Because right then and there, you don't need to hear another word they say. You already know that these people have an agenda. They have an agenda. And they don't care about your needs. I'm not going to say any names specifically. I'm not going to get myself sued or in trouble. A lot of these companies and organizations are a lot bigger than mine is. But that doesn't mean I'm not going to tell the truth and tell you that this happens, not just with one person, with multiple people, and on both sides of the coin. It happens with Medicare Advantage plans. It happens with Medicare supplement plans for various different reasons. It typically happens with Medicare Advantage plans because the agency makes more money, typically, on a Medicare Advantage plan. There's a surprise if you didn't know it. There's different commission schedules for an agent or agency. Agents are typically going to make a higher commission on a Medicare Advantage plan than they will a Medicare supplement plan. Now, the commission on the Medicare Advantage plans, for the most part, is going to be the same from one company to another. So, for me anyway, with the way my contracts are set up, I don't really benefit at all doing one company over another. But do I make more money as an agent selling a Medicare Advantage plan than I do a Medicare supplement? Yeah, I do. But I don't care. I've never cared. I am always going to do what I feel is best for my clients and customers. I have a lot of clients that listen to this show every single week that have Medicare supplement policies through us. And I've told them that's the way to go. I offer both. I try to make sure people are looking at both and making an informed decision on what they feel is best for them. I don't ever just go into a meeting with someone, or I don't ever just get on the phone with someone and say, this is what you need, before I hear what they have to say, ever. I want to know what you need before I can tell you what I feel that you need. I want to know about you. I want to know about your situation. I want to show you both sides, give you an unbiased perspective on both sides, and let you decide what you feel is best. I want to tell you the risks, the rewards of both. And that's the way it should be, but not enough people do it! That's the biggest problem in this industry. That's the biggest problem in the Medicare world. People have agendas. A lot of people do. And next time you're taking advice from somebody that's telling you this is the way you need to do it every time, I hope you take what I'm saying into consideration. Because it's true. It's very important. And there's no such thing as an absolute. Absolute meaning every single time this is the answer in Medicare. Because we're all different. We're all very uniquely structured. Our lives, our situations, the way we look at things. You're all individuals. All of us. And you need something individually picked for you, not some cookie cutter thing that they offer to everybody because they benefit the most. Don't fall into this trap. Run away from it now. Make a decision that knowledge is power for you. The more you can know, the better equipped you are to make a decision. But anytime you're getting propaganda pushed down your throat, you're that much less equipped to make a good decision because you don't know all the variables. You don't know all your choices and you don't know all the information. I have to take a break. I have some final thoughts I'd like to share about this in our third and final segment. Don't go anywhere. I'll be right back in segment 3. Welcome back, everybody. Thanks so much for sticking with me. And thanks for sticking with me through my emotions on that. I just get really heated about this stuff because I'm passionate about this. I'm passionate about this being done the right way. I'm passionate about educating people. If you haven't noticed, why do you think I do this show 3 times a week, every single week? For the amount of time we put into it? I love this. I love helping people. I love working with people. I love the Medicare world, but I also understand that it's got flaws and it's got people out there that are just serving themselves. And I want to do what I can and use my platform and use my reach to speak out against it. And I appreciate you letting me do that because I feel like it's important for a lot of people to hear. Thanks so much for taking the time today and being with me. We're still in what's known as OEP, which stands for Open Enrollment Period. It goes from January 1st to March 31st. If you have a Medicare Advantage plan and you'd like to change to another Medicare Advantage plan, feel free to reach out to my office. We work with people in the states of Utah, Idaho, Colorado, Oregon, Texas, Florida, South Carolina. Again, that's Utah, Colorado, Idaho, Oregon, Texas, South Carolina, and Florida. And we work with all of the largest insurance companies in the nation. We can help you find the best available plan based on your needs and preferences. If you just maybe signed up for something that you don't necessarily like, or maybe you were tricked into something, maybe you were told a plan would work a certain way and it doesn't. That's what this time period's for. It goes from January 1st to March 31st. You have one time to change something. We'll do an episode about it before it's over. Our office number is 801-255-5340, 801-255-5340. Talk to me specifically. If you call this office saying you came from the podcast, I will talk to you. I'll talk to anybody that calls from the podcast that wants to have their plan compared. I'd love to talk with you. Of course, if you're in the states that we are allowed to work with you in. If you call from a state we're not allowed to work with you in, there's nothing I can do for you. We're not licensed everywhere. License fees are enormous. We pick up states by demand. We're working on picking up California right now. I'll let you know when that gets done. I've been from my understanding, it might take a while. It's not easy. They have some hoops they make us jump through. And stay tuned for The Insurance Funnel, the new book I have coming out. It'll be out very, 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 very shortly. This month for sure. Thank you so much, folks. I'll be back with you Wednesday. Hope you have a great day. Thanks for taking some time with me. Take care.